Angelina with Georgia SurgiCare, SurgiCare Arts, and all the institutes in the world. Atlanta Institute, Tampa Institute, Ideal Body Institute. We're just doing our series on all the questions that I get asked, and these are some of the common questions that we address during our consultations. So today we want to talk about tummy tucks. It's Mommy Makeover months. Everybody running special with Mommy Makeovers because of Mother's Day, so this is a good time to talk about it. Okay, who's the candidate? Patient who usually come in for tummy tuck. The ones who had dramatic weight loss. So you lost, that really doesn't matter, just enough weight where now you have flappy skin. That extra roll on the bottom that you cannot work off. You can work out all day long. The flap is still there. It's just going to get thinner and longer. The muscles are separated. So rectus abdominis muscle, the six-pack muscle, that somehow got separated, and it's either due to weight, weakness, pregnancy, all those things can contribute to that. We want to put that muscle back together, and that's also part of the procedure for tummy tuck. We'll put the muscles back together, kind of like an internal corset in a way. People who had aggressive weight loss after bariatric surgery. So this is a very common population that we see here because we do have bariatric surgery in our center. And so people lost 100 pounds, 200 pounds, they come in, they have excessive skin everywhere, their arms, their breasts, their belly, the legs. So that's another reason to do tummy tuck as part of the body lift procedure. What does the tummy tuck pre-op consist of? Usually how it all starts, you come to see me, we sit down together, we look at you, we measure you. I do physical exam, I make sure there's no abdominal wall hernias. I want to see what kind of surgery you had in the past, what kind of scars you had in the past, to see what is possible. There are different types of tummy tucks. There is a kind of a standard tummy tuck that everybody always sees on TV, where we just kind of pull the skin down, put the muscles together, reposition your belly button. People who had excessive weight loss may need to lose some skin in the middle as well, and that's a little bit extra work, and also gets the scar up and bottom as well, because now we have to shrink skin this way, but also have to shrink skin this way. There's a mini tummy tuck for people who only have that kind of bottom pooch, but the upper abdomen looks okay, and we can combine it with some liposuction and skin tightening procedures and get just a mini tuck as well. So the pre-op would be your visit with me, your consultations, where we make sure you're a good candidate for procedure, choose the type of procedure that you need to have, and then once we set, we have a surgery date. Usually we'll bring you back a couple weeks prior to surgery, where we're going to do all the blood work and EKG if I need one on you, and any kind of medical workup, measuring you for garment, taking before and after pictures, obviously answering all your questions about the facility and where we're going to do it, and all your post-op. How long does surgery take? Surgery, again, depends on your size. People come in different shapes and sizes. If it's a mommy, a makeover, tummy tuck, somebody who's 140 pounds, just has a little extra skin, that might take 1.5 to 2 hours. Somebody who's kind of bigger and we're doing excessive skin excision, that might take up to 4 hours. Recovery time. Recovery time usually takes, I usually say hard recovery of 2 weeks. First few days could be painful. We do help with extra medication and Exparel, which is an even extra medication to help with pain. You have drains for up to 2 weeks. Usually I take one drain out about 5 days after procedure. Second drain comes out about 10 days or so after procedure. Plus minus, I have to look at you physically to determine when I want to take them out, but those are approximate dates. After that, about 2 weeks, most people are able to drive. I do have some people who want to have that third week off of work. They're just not quite ready. And of course, it depends what kind of work you have. Some people may have, kind of heavy lifting or really active type of job. They might take more time off. If you have office job, I have people working from home on the second week. how long will it take until I can exercise after tummy tuck? I want you to up and walk first day of surgery. So you're walking out of here. I want you to be up and walking every hour after surgery to prevent blood clots. You will not want to do marathons the first couple of weeks because you're not going to want to, you're not going to like it. But I want you to walk. I want you to see how much you can do, but not necessarily overdo it. After a couple of weeks, once you start kind of feeling a little better, I'm okay with you do activity as tolerated, but I don't want you doing heavy lifting, any kind of squatting or working your abdominal muscles for about 6 weeks. Consults, you can call us and we'll write the number down somewhere on our links. We have website, SurgiCare Arts and Aesthetics. The website is surgicarearts.com. We have YouTube channel, so don't forget to subscribe. My Instagram and Facebook pages are always updated, and you can message us there. One of us, me or my staff, will answer. And we see people Monday to Friday, sometimes Saturday. Here in main facility in Lawrenceville. Our Buckhead office is coming up soon, so in a few months we'll have the same thing going on in Buckhead in Atlanta. So stay tuned for Cosmetic consult with Dr. Angelina, and you have to subscribe and follow me right here on YouTube, and write us your comments and suggestions. So if you want to hear about anything in particular, I'm happy to cover that as well.